Parents, it's long been said that inflammation is the root of all disease. But is that really true? Well, it's definitely a big part of the story, especially with chronic illness and immune conditions. And there's solid evidence that chronic inflammation is not only involved in conditions involving our gut and our immune system, but also the brain and the nervous system with things like autism, ADHD, anxiety, and epilepsy. But while the traditional medical doctors throw heavy-hitting medications like NSAIDs, corticosteroids, and so forth at it, and integrative medicine or biomedical practitioners put patients on intense diet changes, detoxes, and vitamin or supplement protocols, for the vast majority of patients here today, there is an even deeper, almost hidden root cause to chronic inflammation and illness within our kids and within our families. While biomedical and functional med testing looks way deeper than traditional medicine does, there's no amount of lab testing or blood work that will ever find stress and dysfunction in what's called the vagus nerve and our autonomic nervous system. While it may sound so stinking simple, and it is, chronic stress is the number one hidden in plain sight cause of inflammation even in kids. Parents, in this video, we're going to break down the most advanced and up-to-date science on inflammation and chronic illness, with a special emphasis on the role of the nervous system, stress, vagus nerve dysfunction, nervous system dysregulation, and what's called sympathetic dominance. Parents, we're going to be revealing how optimizing vagus nerve function and getting the nervous system balanced and regulated could hold the key to so many of your child's health struggles. We're going to learn all about safe, simple, and gentle ways that you can stimulate, activate this essential part of the nervous system, and how, most importantly, how to first find out if your child's nervous system and vagus nerve are stressed out and dysfunctional, and what caused it to be that way in the first place. Parents, approximately 27% of the children here in the US have chronic conditions, and 1 in 15 have multiple chronic conditions. Moreover, there's research that indicates the prevalence of chronic conditions is on the rise among pediatric patients. This is a sure sign that the traditional medical system is failing our families, and that while inflammation is absolutely a big part of chronic illness pathways in our kids, there has to be more going on that's not currently being addressed with the conventional and often even the biomedical approach. With all of these health issues on the rise within our kids and within our families, we have to ask the question, is there something more going on than just poor gut health, dysbiosis, and microbiome issues? It's part of the story, but it's not the whole story. Because once parents start digging into chronic inflammation, 95% of the information online will rightfully and awesomely take them deep into the biomedical field that talks all about our gut, the microbiome, how it controls and connects to our immune system, and inflammation, and so forth. That leads parents on an awesome journey to remove gluten, dairy, grains, sugars, toxins, dyes, so forth, and often add in all sorts of diet changes, detoxes, and vitamins, supplements, and so forth to try to heal the gut and combat inflammation. This path is extremely helpful, and it can be effective, but it's also often incomplete. And parents, the reason why is because the number one missing part of the science and the conversation, even in the natural health world, is stress onto the nervous system and neurological interference, and more specifically, what's called vagus nerve dysfunction and dysautonomia. You see, the vagus nerve is the longest nerve, and it's a cranial nerve, so coming from our skull, running from the brainstem to major organs like the heart, like the lungs, like the gut. The big thing here is that it coordinates the parasympathetic rest and digest response, which is crucial for activating the body's self-healing and recovery processes. And you know what? We now also know that the vagus nerve is significantly connected to our immune system, and specifically the control and regulation of inflammation. When their vagus nerve becomes interfered with by things like subluxation or neurological dysfunction that we talk about within our office, along this big pathway, gut and immune system dysfunction then sets in. And inflammation can run rampant even with the most pristine diets and all sorts of lifestyle interventions, supplements, cold plunges, saunas, and so forth. All of this information, it leaves parents with one question. How the heck do we find vagus nerve dysfunction? Especially if this is the hidden cause of all of the inflammation in our bodies. Biggest thing for us parents, as neurologically focused pediatric chiropractors, we have to measure what's going on within the neurological system. And that's where the insight scans come in. Primarily, what's called the neurothermal test, because it can detect areas of inflammation, subluxation, nervous system irritation, and temperature changes within the neurospinal system, indicating vagus nerve dysfunction and nervous system dysregulation. The best test that we can do, and it's the gold standard even from a medical standpoint, is heart rate variability, or HRV testing, to be able to measure the balance between our fight or flight, sympathetic, stuck on stress, stuck on inflammation mode, and that parasympathetic gross recovery and healing side of our nervous system. What's deeper about heart rate variability and thermography is it's revealing what's called dysautonomia, or dysfunction within our autonomic nervous system. That's actually a diagnosis being placed on patients these days. And what's really interesting and what's more important is it gives us understanding into the body's ability to manage stress and inflammation. So with the insight scans and the testing that we do within our office, it provides a comprehensive view of our nervous system health, to be able to then help to identify underlying issues. Parents, if your child is struggling with inflammation-related symptoms like immune or autoimmune disorders, autism, anxiety, seizures, or other neuroimmune-related health challenges, it's time to look beyond just managing symptoms and even just addressing inflammation through diet changes, through nutrition, and natural health measures. Balancing the autonomic nervous system and optimizing vagus nerve function is absolutely essential for resolving persistent inflammation that does not respond to either traditional or biomedical interventions. If you're tired of seeing your child sick, inflamed, and struggling with their health way too often, despite feeling like you've tried it all already, give our office a call to schedule your nervous system dysregulation and your vagus nerve dysfunction scans and find the real root cause of your child's chronic inflammation and your health struggles. We'll be waiting for you.